So we will be briefly discussing practical things. There's a lot of theoretical things and many printed documents, guidelines on COVID management, isolation, and now protocols about vaccines will all be coming. But I'll be taking practical course and I'll be discussing how practically I'm managing COVID patients in my own practice and how we can help and continue to practice even during the COVID times. So, with a caveat that we all have to continue to take precautions because you never know how do you get COVID infection contracted from any of your patients randomly can walk in and you can, we all are at highest risk. If you look at the death tally, the general practitioners, family practitioners among the doctors who are highly impacted. The first death which happened of any medical professional was a family physicians from Mumbai, Indore, sorry, and then we had cases in Mumbai, and family physicians are at risk because we are the first contact providers and we see undifferentiated patients when they come to us, and normally they would come with any symptom, fever, cough, cold. This is a common problem. They come to us and they can turn out later on COVID also in the present scenario. So we have to be very, very careful when we practice, and all precautions, COVID appropriate precautions, not only for general public, but for ourselves also, we have to practice by heart. So this is the current situation of COVID across India. So largely we understand that COVID is a devastating disease, and lakhs of people across world have lost their lives. But what is the role of family physicians, family practice in this overall scenario, and why we are important in the current scenario? So just to explain it, and probably if you have attended one of my previous lectures, I've also explained this, why family physicians are important in any given scenario, especially in this COVID scenario. So this is one study from New England Journal of Medicine, which is called, it's a classical paper of family medicine, ecology of medical care, where it says in a given population of 1,000, in any given month, around 750 people will face some kind of illness or injury. Out of this, only 250 will actually go to consult a doctor or a primary care provider in that particular month. Only 9 of these 750 people will actually require admission in inpatient basis in a hospital, and out of 750, only 5 people will require some kind of tertiary care referral, medical college hospital, and one person only would go to a teaching proper aims like institution. So you see, there is large number of patients who are every month, every day inflicted. The morbidity is very high, as of 750, whereas the patients which present to the hospitals and teaching hospitals and tertiary care hospitals are only a fraction of that illness. So same situation is true with COVID also. The number of patients presenting to hospitals for with severe diseases is actually very less. And if you look at the current scenario with people moving around, there is unlockdown across India in phases, and we saw during the festivals, even during the New Year times, people traveling, travel restrictions are being gradually removed. So what we see at hospitals is only fraction. What actually is happening in community level is very, very high. So large number of people are affected. They may have mild symptoms and they may not many times even consult a doctor. But it is important that we understand that majority of the positive cases are lying and living in the community, and they are to be dealt with the community-based family physicians or family medicine specialists. So role of hospital is important, but equally important is the role of family physician who is based in community and practicing and seeing patients in day-to-day basis because we are dealing with large morbidity of patients in the community. The same study was done, and the previous study was done in 1960s, and the same study was repeated in 2000 and published in the same journal. So, the crux of the story is that, family physicians have a responsibility for large number of morbidity in any given situation for any disease, be it diabetes, thyroid, hypertension. Many times patients, when they reach hospitals, they are of some advanced stage of disease, or have some complication and organ damage and all. But when they are a community, they are always with the family physicians, and our responsibility to keep them well, not only well but also treat them as per the current protocols and guidelines. So we should be mindful of what is being currently practiced. If you look at in March, everybody was at loss what COVID is, how it is impacting our bodies, what it is doing inside the body. And we were getting informed mostly by the news reports. We were seeing in social media, newspapers, TV news channels that thousands and thousands people are dying. Even the graves are falling short. People are even buried in group and ditches, and people are falling down in market, and nobody is able to care them. This is this kind of stories we were listening from all across world. But over a period of months, now we have clear understanding what the disease is, why it is called, how it is impacting our body, in what phases it is impacting our body. And if we have understanding of the pathophysiology and outcome and course of the illness, we will be able to manage the disease properly in family practice. And we can, of course, when they are of severe nature, we can refer them to appropriate facility. So after immediately after lockdown, I, like many people also, I actually stopped my outpatient practice in my clinic, because there were no clear guidelines from the government sides. And mostly, even with one contact, there was a lot of contact tracing. And even if your facility gets one patient, then whole facility would be locked, or many times you have to go through, entire area has to go for screening and quarantine. So those were the initial challenges. But after few months, say about, say, June, July, and August, gradually as the things started to open up, um, I also started my practice uh, in my clinic. But of course, I would schedule patients. I would avoid seeing fever, cough, cold patients directly in my clinic. And during this lockdown period, mostly I was seeing patients on teleconsultations, video consultations. I used to do practice on phone. I used to give advice sometimes on phone, but it was not very structured as it has become during the lockdown period. And I myself had a learning curve how to utilize the existing communication mediums for patient consultation in our day-to-day life. So as of now, I am sitting on practice in my clinic on daily basis. Of course, we are taking due precautions. We are screening patients, but it has almost become normal, I would say, in my practice, 80 to 90%. Though we are taking full precautions that we and our staffs do not get infected.